My goal today is to talk about non-pharmaceutical treatments for brain fog and dementia. And I just mentioned before that we have a very diverse audience that participate as members of the membership program at A Mind for All Seasons. So I want to tell you how I even put brain fog and dementia in the same sentence. Because if you've ever experienced brain fog, the last thing you want to feel like is, I think you're headed towards dementia. That doesn't feel very good, right? You're gonna curse me if that were the case. So I created a graphic. This is my graphic, and it's based on the research of Dr. Datis Karazian. He wrote a book called Why Isn't My Brain Working? And it's actually a phenomenal book. Datis has been a great friend. He lives in San Diego. I traveled down and spent the week with him last year. Man, he is just amongst the world's best in neurological disorders. And he doesn't see patients anymore. He just runs a training service for doctors. So that's how I met him originally. But here's how I put these things together. In the literature, there's something called sickness behavior syndrome. Well, that doesn't mean anything to anyone here. We're used to getting a functional diagnosis. But let me explain this. If a person has brain fog, we don't even know what to call that in conventional medicine. If you go into your doctor and you say, I feel brain fog, your doctor knows what you're talking about, but there's not a diagnosis for brain fog. There's not a diagnosis code, but we know that what it means is it's implied we feel slower. We're processing slower. We can't focus as well. Our attention isn't as good. Hell, sometimes we even feel like we can't remember things. We can't remember our words, or we see someone's face and we know them, but we can't remember their name. Some people just describe brain fog as, I feel brain fatigue. My brain is just tired. Well, as brain fog ratchets up in severity, you'll see my little ruler here that I crafted using PowerPoint. The next thing that happens is, as it ratchets up, we actually get a diagnosis. And that brain fog becomes so significant that our doctor says, wow, maybe you have depression. Maybe it's attention deficit disorder and you would benefit from a stimulant like Ritalin or Adderall. Oh, you have major anxiety and panic attacks. And it's weird because you think, well, I don't even know I'm having these. I get out of bed in the morning. I have a good job. I'm not at odds with my spouse. Why am I feeling so much anxiety? Some people experience PTSD, or they get these other kind of physical symptoms like ringing in the ears. So that's weird that I classified those together. These are types of neuroinflammation that now have advanced to the point we get a functional diagnosis. And as our brain deteriorates, or as the symptoms become more severe, in the late stages of our life, some people, it's their early stages. They get a diagnosis of dementia. And they say, well, you have Alzheimer's or Parkinson's disease. This person has disorientation. We need to put them in a locked community because they're sundowning at night. They want to leave their house. And now this is a major disability. So whether you're joining us and you just feel brain fog, which is this slowed issue, or you are an owner and an operator of an assisted living center and you're taking care of dementia, please recognize that I see these on a continuum. And my goal is, instead of ratcheting from left to right, I want to ratchet back. I want to take someone with dementia and just kind of moderate their symptoms. So maybe they just have bad focus. Can you actually do that? Well, I think you can. I've seen it. Years ago, when I was working as a full-time healthcare provider in assisted living centers and the VA, the local VA, I thought it was fascinating. I got this article one day in my email that Pfizer stopped researching Alzheimer's and Parkinson's treatments because they can't fix them with one medicine. This dates back to 2018. This was a part of my practice every day when I read this article. And then Dr. Bredesen came out with this beautiful book, The End of Alzheimer's. Look at the subtitle, The First Program to Prevent and Reverse Cognitive Decline. Well, I actually trained with Dr. Bredesen. I trained with them back when cell phones had cameras, but the cameras were crappy and they took foggy pictures. This is dating back to 2016, 2017. I worked with him personally at the Dallas clinic or at the Dallas Functional Medicine Clinic and got my training there. I kind of wet my whistle in cognitive decline. And I created my first PowerPoint presentation for doctors. And I said, when doctors say there's nothing that you can do for dementia, I always said, are you smoking? There's a ton you can do for dementia. Where do you want me to start? Because each one of the bullet points on this graphic have some research that show you can minimize some form of cognitive decline using each one of these tools. So then the effort becomes, how many of these can I stack together and use at the exact same time to see if I can get a synergistic effect at minimizing dementia? And I quickly learned that not everyone can do everything. You have to really personalize treatment. And how do you personalize treatment? You do some baseline testing, you do some individualized therapy, and you start coaching people through this process. That was kind of the birth of A Mind for All Seasons, how that came about. So I want to take 2 seconds and walk you through an order of operations. Let's say that you run an assisted living center and you have a community with individuals with dementia. I don't want you to leave and think, well, it's too late. I just can't do anything. No, I actually think that you really can. So with the first of the order of operations is we embrace lifestyle changes. The first thing that those assisted living center directors could do is look at their diet and look at how we feed our seniors that have dementia, because processed food is an aggregator of dementia. It makes it worse, right? What's the dental health? Could we take them on a walk each day and get some physical exercise? Number 2 is you've got to do baseline testing. You can't just throw medicines at individuals and expect them to get better. I don't think you can throw supplements at individuals and get better either. I think it has to be very intentional. Once you do baseline testing, then you move into individualized treatments. And hormone optimization is one I'm unrepentant about. I've done a lot of training in the past couple of months about hormone replacement, even in senior women like 75, 80 years old. I don't know why we shy away from it. It actually can make a significant difference in the tearfulness, the anxiety, the sleeplessness, the constant wandering and sundowning. It can really make a difference. And then we put people on very focused, personalized supplements based on their lab work. That just makes perfect sense. We don't put the supplements on people based on what the advertisers at Costco are demonstrating when you walk through the store and you get a sample. That's cool, but it's not personalized medicine. And you get tricked into thinking this is really good. You're paying top dollar for a supplement that someone may not need. It may not do anything. The next thing you do is you address very specific medical challenges. And I compliment the medical community, because the medical community at large is very good at addressing diabetes and controlling blood pressure and those types of challenges. The problem is the medical community often skips everything ahead of that. The medical community doesn't focus on how we eat and how we exercise and what our dental health is like. They only run tests that, unless we have a guarantee that insurance is going to pay for it, they don't even run the testing. And then they've largely said that hormone replacement is dangerous, which is a total blind spot in medicine, according to Marty Makary, who's now the director of the FDA. Once we address medical challenges, we start using nootropics. Nootropics are considered smart supplements. You've all gone to the grocery store and seen Focus Factor, or you've seen a formula for brain. I think those things can be helpful, and I've developed some really strong opinions about which ones are good because I've been using them for 10 years. I've been using them in relatively high dosing with many individuals, and so I have several hundred, perhaps even a couple of thousand case studies of different nootropics that we've used. And then we add on brain therapies. Well, brain therapies is a weird term. We don't have that term in medicine. That's a Randy Vaudry-ism. That's my own term, because brain therapies vary depending on the type of therapy. I'm going to come back to that. We always should work on prescription medication reductions. Remember that in senior care management, When seniors come to the clinic, they have a symptom. And so we give them a medicine for a symptom. The one that's so common is individuals get vertigo. They get vertigo, so we give them meclizine. Meclizine is kind of like a motion sickness medicine that you'd take if you went on a cruise. The problem is it almost always makes dementia worse, almost without exception. There's a lot of people who have terrible mental health and they're on duplicate therapy, meaning they use 2 or 3 medicines in the same class. They're using antidepressants. One's an SSRI, one's a mood stabilizer, one's an antipsychotic. Look, if they're not getting better with those 3 medicines, we need to cut bait and move on and take a different approach. So I'm all about prescription reduction so that we can simplify polypharmacy, all these medicines. And then we reevaluate. We say, hey, look, are people doing better? We jump on a telephone call together and do some telemedicines, and we retest labs, we reevaluate symptoms, and we start contemplating, what in the heck are we missing? We need to identify that. And then guess what? Around we go. We go back and reorder certain labs to see if we've actually made a difference based on the supplements and the hormones and the things that we're doing. Okay. This is the order of operations, whether you have brain fog or major depression or attention deficit, or you have someone with dementia and Alzheimer's. Well, today I'm just going to focus on brain therapies. I'm going to focus on those non-pharmacologic interventions, non-prescription medicines that can make a difference in seniors. And this is something I have at least 10 years of experience doing. Look at all these pictures. These are things where I created, together with Eric and Jeff, a therapy studio in Boise where I put all these medical pieces of equipment and started test driving them with seniors that had dementia. We started doing this before COVID. In fact, in 2017, we were up and running and had a totally awesome studio, and then COVID happened and it just about sunk our ship. But fortunately, we hung in there, we've regrouped. And so I'm going to talk specifically about these types of therapies in individuals who want to improve their brain health. And I'm going to start with this picture. Everyone knows what obstructive sleep apnea is and a CPAP. It's become the standard of care. When someone has bad sleep at night, we now know if they snore or if they're a little bit overweight or if they cough all the time, we need to check to see if they have sleep apnea. It is a standard of care. But why don't we put people on oxygen when they exercise? Have you ever thought of that? If someone could sleep at night and they sleep better by putting a puff of air into their lungs when they take a deep breath, and it's relaxing enough that they could actually do it in their sleep with a mask on, why in the world wouldn't we do this with exercise? Seniors in particular don't like to exercise very much because it hurts. They ache, their muscles get really sore, and they don't recover. Just imagine if you put a mask on somebody and you piped in 85% oxygen, which is 4 times the concentration of oxygen that you're currently breathing at room air. People can exercise for 10 or 15 minutes and walk away and feel like you gave them a double shot espresso. They just feel so good. It aids in exercise recovery. They don't walk away and feel like you just kicked their butt. It's so helpful, and we've been doing this for many years. It makes a huge difference, okay? So exercise with oxygen is not that sophisticated. We don't have a doctor in the office when they do this. We have a CNA, and that CNA helps guide people, helps them put the mask on, walks them through a 15-minute exercise routine, and away they go. It's so simple to do and makes such a huge difference. Everyone on this call knows how it feels after you exercise. You feel alive, you feel energized, you feel actuated, you feel like, oh my gosh, now I can tackle the day. And many of our seniors barely drag themselves out of bed, and they limp to the dining room, or they limp to the table, and they sit in front of the TV and they watch CNN or Fox News or whatever they're watching, and they fill their mind full of media. My gosh, put them on an exercise with oxygen. It's not that hard. It's actually so helpful. I want to show you another video. And this is a pretty fantastic video. I'm not going to give you any precursor. I'm just going to show it to you. So here we go. This is a different type of therapy. This is talking about a PEMF device.
After spinal fusion surgeries, some patients experience impaired healing in which bone fusion does not occur as desired. When this happens in the lower back, doctors commonly prescribe bone growth stimulation therapy such as the OrthoFix spinal stem device. Spinal stem sends safe, low-level pulses of electromagnetic energy that stimulates bone growth at the fusion site. The device is worn externally around the low back, providing full treatment coverage around the fusion site and can reach multiple level fusions up to 5 vertebrae during treatment. When used as prescribed, bone growth stimulation therapy creates a significant increase in fusion success for patients, helping them return to their normal activities.
Okay, so you might be asking yourself this question. Why is he talking about a bone stimulator? Well, there's probably 15 of these companies on the market, and their primary target are orthopedic doctors that do surgery. These devices are called PEMF devices. PEMF stands for pulsed electromagnetic frequency therapy. And when they have an individual where they do a spinal surgery and their bones are not healing very well, they put one of these devices near the bone and it increases their success rate by 90% healing and 90% recovery from that. Isn't that amazing? Well, is that technology only available if you have a surgery and you don't have good bone healing? Of course not. The FDA has approved PEMF devices for healing fractures and healing wound tissues. And check this out. They've also approved it for pain management and tissue swelling and even major depressive disorders. Well, that's pretty fascinating. How come you haven't heard about this? Well, I downloaded the PDF from United Healthcare about who would qualify for a bone stimulator after therapy. These are screenshots of their actual approval rating. It says, look at the yellow box or the red box. If they've had a previous failed fusion, that means that they had to have had a surgery that went terrible before and they didn't heal, or when they've had at least 6 months where they're not healing. So the insurance companies don't want to pay for a bone stimulator. They want you to go 6 months after your treatment to see if you're going to heal, right? And so they will not initiate this therapy up front. You've got to go through the process. Well, that's kind of a disadvantage. Is if I was an osteoporotic female and I was going to have a bone surgery, I'd want a bone stimulator on the moment I came out of surgery, because if there's a 92% adjunctive healing rate, why wouldn't we do this? It's because it's not covered by insurance unless you get, you guessed it, prior authorization. My gosh, I spend all of my time in primary care trying to get prior authorization to prove that a treatment is medically necessary, that individuals are failing other interventions in order to get this. This is just the way of the world. Well, NASA actually studied pulsed electromagnetic frequencies, and you've probably seen this recently because we rescued the 2 astronauts that were at the International Space Station, and after coming out of space for several months, they can't even walk. They're so weak. They're osteoporotic. These individuals do phenomenal with pulsed electromagnetic frequency. Here's why. Check out this video. This is what typical blood flow looks like through a small capillary bed. And when you connect them to pulsed electromagnetic frequency, that's what it looks like. Those electromagnetic frequencies stimulate blood flow to the tissue. Okay,
The Beamer
so
Go is
listen
amazing.
to
The
this
fact that I
lady.
can use it anywhere is incredible because my lifestyle, I pretty much live out the car. I swim, I bike, and I run because I'm a professional triathlete and I'm moving from place to place. So the fact that I want to be using the Beamer in between workouts to help with my recovery, it just means that I can throw it on my back, throw it in the car, and use it on my way to different sessions, sit on it while I'm driving, or just in between workouts, even as I'm stretching.
So I'm positive that she's probably a paid advertiser for Beamer Therapy. But one thing I liked about that little advertisement video is she doesn't wait till she gets sick. She doesn't she is a 5-time world triathlete champion. She's won 5 Xterra championships in a row. She's amazing. But it's not just professional athletes. It's not just people who want to recover well that do this. This is a study out of Italy that shows cognitive testing found a 60% improvement in cognitive abilities and spatial perception and time. It increases blood flow to the brain and through the nervous system. So PEMF therapy is amazing. I did a little AI search about what's the difference between PEMF therapy and grounding therapy. My good friend Carol, who's with us today, asked me a question. Well, tell me about grounding. So look at the difference here and just read the parts in red. You could read the whole thing if you wanted to go back and look at this, but electromagnetic fields are various frequencies and intensities, and they interact with the body at a cellular level and stimulate cellular energy communication and repair. They have a growing body of scientific research. Some PEMF devices are approved for conditions like bone fracture healing. Hey, that's kind of cool. I just talked about that. And it typically involves a device that you sit on or you attach to your body for a short period of time, and you energize that body with electromagnetic frequency. Very simple to do. Okay, let's talk about another one. How about red and near infrared light therapy? I got to tell you a fun story. In 2017, we purchased a red light helmet for our clinic. And one of Eric's good friends is a neurologist. He doesn't focus on dementia. And do you know why? It's because he told us no one gets better. I want to help people get better. Well, I disagree with him. I think people can do better, but he just works on headaches. And we took him some research about red and near infrared light therapy and cognitive health. And this guy was actually so inconsiderate and rude. He's like, oh, there's no research about this. Well, it irritated me because there's been about 5,000 blinded clinical trials used in all types of medicine, not just neurological medicine, but orthopedic medicine and healing and so forth about red and infrared light therapy. I thought this guy just doesn't understand the research. Well, back then we put a red light bed and a red light helmet in our clinic. Everyone thought we were crazy, and now you can't turn around on every corner. There's a red light therapy bed, right? So red light is a type of human photosynthesis. And you guys know this because if a baby gets jaundice when they're born, we put them under UV light. It's not magical. This is not voodoo functional woo-woo medicine. This is legit. This has been used for 50 years in a hospital. And you could go to any hospital in the major cities where you live, and they have UV light therapy that they use for neonatal infants who have jaundice. It's real science. This light box right here is actually a light box that my mom has at her house. It's a UV light box because my mom has bad psoriasis. So this isn't a picture of her house. I actually have a picture of my mom sitting in her light box, but she did not give me permission to share it. So I had to go online and find a different picture. She uses her light box twice a week and has done so for 10 years. This is at her house. Light therapy makes a difference. Human photosynthesis, you all know this because we know we get vitamin D from the sunlight. UVB radiation hits our skin, it interacts with cholesterol, and there we have it. We produce vitamin D. Well, I'm currently wearing a long sleeve shirt and we're in mid-May. It's because it's been stormy all week. I haven't got my vitamin D, so I have to take vitamin D because I'm just not getting it from outside. Michael Hamblin is a PhD researcher from Harvard and Massachusetts General Hospital. He has since retired. I had a couple of telephone conversations with him during the COVID pandemic as he was helping us identify good red light therapy. Margaret Nazer is another one that I had multiple conversations with. This is the red light helmet that we put in our clinic. Interestingly enough, in 2019, it cost $50,000 for a red light helmet. That's out of reach. But guess what? They're all over the market now. You can find them in everywhere. Mito Red has a red light helmet. Neuronix has a red light helmet. This is good science, and the research is growing. You might think, why in the world does that lady on the left have a probe up her nose? Well, it's not up your nose with a rubber hose. It's because many red light therapy devices have a probe that goes into the nose because you have so much vasculature. You have blood vessels all through your nose, and red light interacts with red blood cells in a very significant manner. So many of these companies have a nasal probe. Now, just imagine during COVID, we had one of these devices in our clinic, but no one wanted to stick a nasal probe up their nose when the next person stuck a probe up their nose, and we were all trying to socially distance ourselves so that we didn't get COVID. So naturally, we had to put that away and not use it anymore. But you can just buy a red light probe for your nose for a couple $100. It's amazing. There's full body applications. This is called a Novothor and a red light bed. We have a red light bed in our clinic, and many of our clients will say it's the favorite part of their day. There's something so relaxing and yet so energizing about bathing your body in red and near infrared light therapy. Let's talk about a different device, audio-visual entrainment. And I've got to tell you a story about this particular device. I was doing some consulting in an assisted living center in Arizona. And while I'm visiting with the ownership group, this guy comes to the front lobby yelling and screaming and demanding that his wife come right now, get me out of here, cussing and yelling. Man, he was so angry. And they looked at me and said, hey, this is why we hired you, Randy. You got to help us. This guy does this 2 times a day, every day. We just can't calm him down. And I said, well, I want you to get a David Delight Pro. And I told him where to buy it. Get this device. I'll come back next month and teach you how to use it. Well, I went back next month. Do you think they bought it? No, because it looks hokey. What are you going to do with it? So the next month I bought one and took it to him. And sure enough, this is no exaggeration. While I'm there, the same guy comes down the staircase cussing and screaming about his wife being late. And I said, hey, I'm so sorry. Your wife called and let us know she's going to be delayed, and she asked us to give you a spa treatment. I don't want no damn spa treatment. He's just swearing at me and yelling. And I said, well, I'm so sorry. She's coming. Come in here and have a seat. And I kind of rubbed his shoulders and he sat down and I said, we're just going to do a really simple spa treatment. He's moaning and groaning. And I said, here, I'm going to put these headphones on your head. I'm going to put these glasses on your eyes, these little clips on your ears. And I pushed play. And within 5 minutes, this guy was sound asleep. I put him on such a relaxation setting that it put him to sleep in that chair. The owner of that clinic looked at me and said, what in the world did you just do? And I said, well, let me explain how this works. There's a lot of research that's been done on brain entrainment. Now, you see these little squiggly lines there. Those squiggly lines represent a brain wave. And we know that there are brain waves that are associated with being awake and being asleep. And if we modify or change those brain waves, we can actually calm inflammation in the brain and change a state of thinking. So here's an example of the different brain waves. And I'm not going to take the time to teach you the specifics, but I want to let you know that they have done brainwave studies in individuals with dementia. And people with dementia, if you look at their brainwaves are down here in a dreamy state. They're in a state of deep meditation, almost as if they were sound asleep. Now, you guys have all heard someone talking in their sleep, and you've heard someone sleepwalk. They're sound asleep, but they're up and moving, or they're talking. There is a lot of discussion that dementia may do this to individuals, that their that their mind is asleep, but they're walking and talking, they're up. So David Delight will change their brain waves so that we can either help them actually go to sleep, or we can wake them up and have a little bit more of a rapid brainwave so they're functional. It really is amazing technology. It doesn't require a prescription medicine. A treatment can last as few as 15 minutes when they do it, and you can change someone's brainwave and brain state for an entire afternoon doing something like that. It's amazing. Most of you had sat in a sauna before. Did you know that there's research that the more you sauna bathe, it's inversely associated with Alzheimer's disease? I'm going to say that a different way. You get less Alzheimer's complications and challenges the more often you put people in a sauna. Well, not only does it help with Alzheimer's disease, but it lowers the risk of heart disease. This study was published in the Journal of the American Medical Association. This is not some small journal. This is a large impact journal, and it's now 10 years old. But when was the last time that your senior care doctor told you to sit in a sauna? They don't tell you. We don't talk about this. It's a non-pharmaceutical intervention. We know that saunas lower blood pressure and reduce chronic pain. If you've sat in a sauna, you know you get out of the sauna and your joints work better. Why aren't we doing this in senior living? Why doesn't every independent or assisted living center have a small little sauna that people could sit in for 15 minutes and warm themselves up and lubricate their joints, get them going, improve circulation and cardiovascular health? People leave feeling relaxed and a sense of vitality. They're amazing. And there isn't a day that goes by that I don't see an advertisement about detox. And everyone thinks detox is, oh, I just should juice something. I'm going to juice a bunch of fruit and vegetables, or I'm going to take chia seeds as a binder. Well, sauna actually helps with detox. Look at this. I've done hundreds of lab works and clinical studies on seniors where we're looking for toxicity. This is some lab work from one of my patients that had high levels of styrene and benzene. These are plastics. Look, he's almost in the 90th percentile. Or acrylamide, right? These are forever chemicals. Look at that, 95th percentile. Or dimethyl-phosphate, all of these pesticides and herbicides. Look at this dimethyl-phosphate over here, almost in the 100th percentile. There's research that shows that when you do sauna therapy, you pull toxins out of your body because it comes out in your sweat. Now, I don't know about you guys, but I'm not a great sweater. I can actually work out pretty well and hardly even break a sweat. Well, most of our seniors don't sweat anymore. They've lost the glands. They're called eccrine glands that allow them to sweat. They just don't. When we've done sauna therapy and some detox supplements, these are changes. Look at these reductions in repeat lab work. 62% reduction, 80%, 20%, 63, 32, 100% reduction in organophosphates. Now, what about these where there was an increase? I don't know. That's an interesting thing. Why did they increase? A lot of people say is you have to mobilize a toxin, so you mobilize them from the fatty tissue into the bloodstream. Sometimes you see a temporary increase. The interesting thing is this person did so much better when we used sauna therapy and some detox supplements to help them clear those forever chemicals. Okay, so again, Journal of the American Medicine said sauna therapy helps both with dementia and heart disease. So I want to leave some time for questions because, man, I could have gone in depth. I didn't even talk about hyperbaric medicine. And you might think, why didn't I? It's because I've done 3 or 4 presentations earlier this year about the use of low-dose hyperbaric therapy, and I just didn't want to repeat. Maybe I need to. Maybe I need to go back and do some of those. I can certainly do it in the future because I've already prepared some of those presentations. But in today's masterclass, all I've done is scratch the surface. There's many other interventions out there. Transcranial magnetic stimulation. Man, I've talked to a lot of practitioners where that is the only thing they do. Biofeedback. Other practitioners, they connect you to some biofeedback and they do some therapy while they're doing biofeedback. Changes brainwaves. It's amazing. Grounding therapy. Carol asked me about grounding. Grounding is when you go outside and you let the electrons from the earth, those free electrons, come into your body and they serve as an antioxidant, if you will, to bind against a free radical and neutralize them. Peptide therapy. I've got some presentations that are up and coming where I'll talk about certain peptides like SS31 or talk about rebrolysin, which is a really nice peptide. There's a whole bunch of them, and so it'll probably take a series of presentations. But my point is to let you know that these are things that are being used in chiropractic offices, naturopath offices, massage therapist, physical therapy offices. And so because most of the American medical system comes through conventional medicine, where insurance doesn't cover a lot of these, doctors don't talk about them, and therefore individuals don't really understand what the potential for benefit is. Most of these therapies require some sort of a cash pay or a purchase or an acquisition. And one of the things that we did at A Mind for All Seasons is try to acquire many of these devices so that people could come to town, spend a week, learn about them, and identify, is there something that they wanted to invest in? And I know that many of you have invested and used some of those therapies as well. So I'm going to come back to my order of operations. Sometimes you hear influencers, and influencers on social media will say, take this supplement or do hyperbaric or use this therapy. They're motivated to say that. Their financial system is directly tied to that. I want you to know that I'm very focused on identifying root causes of neurological disorders and addressing them. And I've grayed out all of the things that I talked about at the beginning because this presentation is really just designed towards brain therapies. I want to introduce this model so that individuals can be aware. If you have a good system for doing everything else, then at A Mind for All Seasons, we can actually help you with some brain therapies. We can help you get standing orders or protocols, or I've purchased personally almost $500,000 worth of these devices so I can see how they work. Sometimes I say that and I'm actually embarrassed by it, that I've spent so much money trying to figure out what works, what doesn't work. Could an individual buy this and do it themselves, or do they have to have a tech like myself or a CNA do it for them? Spend a lot of money and spend a lot of time really understanding what works for seniors, what works for adults, and what are the price points that you can get them. When I spent $500,000, if you bought all this stuff at today's dollar, it would probably only be 100,000 because the pricing has gotten better on everything. There's more competition, there's more devices out there, and I'm all about trying to help you get great equipment, great devices at very low prices.